Welcome everyone to Flyover Footy. My name is Matt Baker. Thank you for joining us on this special medical minute moment of Flyover Footy. We're doing a special look here at some of the recent St. Louis City injuries. This may be a recurring special edition episode, so hopefully you like it. I'm joined by an extremely special guest today, Dr. Greg Nelson. Dr. Nelson, thank you so much for joining me. Why don't you just start into it? Let everybody know who you are, what your credentials are, and why we're here talking today.
Yeah, Matt, look, man, I'm so excited to be a part of Flower Footy. Been a fan for a long, long time. And we had a couple of serious injuries for our players, things that have really hit home pretty hard recently. The moment that I had the thought about this, I was watching the game where against Miami, Rasmus was injured, and then I was on socials and people were speculating about what was the nature of that injury. And I thought, hey, I think I know what that is. That's an MCL. And so I'm so excited to have an opportunity to get on and maybe shed some light for other listeners about the nature of these injuries, what we can expect, and hopefully lower some of the anxiety that we're all experiencing after having watched Salio's nasty injury. So yeah, thanks so much for having me on here. Just about me, I'm an orthopedic surgeon here practicing in St. Louis. I've been here in practice for 7 years. Actually trained at Barnes, and so very, very familiar with the St. Louis community. Pretty excited about an opportunity to share some of that knowledge and give that insight.
Yeah, so you're a board certified orthopedic surgeon, SSM, you said, St. Louis. The credentials are there. So obviously now transitioning into talking about St. Louis City. Do you want to dive right into it? And why don't we start with that first injury that really had you thinking, all right, I think I know enough to be speaking on this publicly. Let's before we get into Rasmus Alm, with the caveat, I think the one caveat as we get into this, obviously you haven't treated Rasmus Alm, you haven't treated Salo Pompeo. Your expertise in the field speaks for itself. Long history as an orthopedic surgeon, but I do want to add that upfront caveat that there's been no specific treatment or evaluation of these individual players. You're using your vast wealth of knowledge and history in the field, and you said right off the bat that as soon as you saw the Rasmus Alm injury, you had that inkling MCL. Turned out to be right. So let's dive into Rasmus Alm. When you saw that injury, looking at it, can you talk us through a little bit about what you saw when it happened, maybe mechanisms of the MCL injuries themselves?
Yeah, absolutely, absolutely. Yeah, so I'll just reiterate. Of course, if I was treating players, I wouldn't be allowed to speak about it. You know, there's a HIPAA, Health Information Privacy Act, would forbid that. But as a fan of the game, obviously we watch these things. I find that I even see people out on the street and I notice like, oh, that guy's walking in a certain way. I bet I know what his diagnosis is. It's just part of the business. So watching Rasmus Alm's injury, if you guys remember back, he made a challenge on the ball. He planted his foot first. The Miami player, defender, kind of came into him from a outside to in force. We call that a valgus type of a force, which is going to put stretch on the inner part of the knee. That's where the medial collateral ligament is. So medial just means on the inside. Of course, there was concern about, you know, is it maybe an ACL? The ACL is a ligament that's in the center of the knee, but it was generally ACL injuries occur with more of a non-contact rotational kind of a force. And so it was pretty clear to me that this was probably an MCL. Now, MCL injuries come in a couple of grades. Grade 1 would be the lowest, grade 3 being the highest. Isolated grade 3 injuries, which would be a complete rupture of the MCL, are fairly rare. And so it was pretty clear to me this is probably more like a grade 2 injury. And without the rotational non-contact sort of mechanism, I didn't think the ACL would be involved. We found out that was the case.
So an MCL, if I'm understanding correctly, just to not just for now but also in the future, MCLs typically happen with contact injuries in what it forces the leg to do. ACLs typically non-contact. Is that a baseline for how people can view this and expectations in the future?
Yeah, if you look at the epidemiology of ACL injuries, which everybody knows ACL is kind of that that ligament that's heard of. Those are often non-contact injuries. They often involving planting on the injured leg with some kind of rotational type of a force, because the ACL's primary role is to control rotation of the tibia and femur, so that the foot's not going one way and with the leg rotating the other way. Again, if we go back to this particular clip, you would see that it was more of a bending kind of a force coming from the outside in, and that's going to isolate the MCL and stretch the MCL. So that's what I anticipated. That's what it sounds like has come out of that. And so the good news is the timeline for Rasmus Alm's recovery is faster from an MCL injury. MCL injuries have a very high rate of healing without surgical intervention. And so we can start to speculate a little bit about where Rasmus Alm would be in that fact.
And you mentioned grades of injuries. Can you talk us through a little bit about what these grades mean? And you mentioned, I think Rasmus Alm was about a grade 3 or so. It impacts the timeline, but what are these grades about MCL injuries?
Yeah, absolutely. So grades just give us a sense of the severity of the injury. So a grade 1 injury is more of like a few fibers within that ligament would be stretched. A grade 2 injury is going to be more like maybe 50% of them are stretched. And that's going to be fairly subtle in terms of the difference. That's probably a clinical definition. You're going to figure that out from how stable the knee feels. So if I examine a patient with a grade 1 MCL injury, basically, I'm going to try to recreate gently, but recreate that kind of force that Rasmus Alm experienced. And the patient's going to say, oh, that's pain. But I'm not going to feel that the knee is very loose. Then at a grade 2 injury, I might feel that the knee has more looseness or more wobble in my exam, but it's not going to be like really, really out there like, whoa, that's really unstable. I can feel the bone shifting. And then a grade 3 injury, which again would be like a complete rupture of the MCL, I'm going to really notice that there's a lot of laxity or looseness or gapping between the bones when I examine the patient. So again, I think Rasmus Alm's injury is probably more like a grade 2 injury. He did have quite a bit of deformity during just watching the video, but he had enough that he doesn't require any kind of surgical intervention, and that probably put him in that middle range.
So the club set the expectation, I think, right off the bat, that it was a 6 to 8 week recovery timeline. And from my experience with the club estimates, they usually put out that's a return to practice, not necessarily returning to be able to play games, because obviously you have to get your fitness worked up after the injury itself resolves. But I think we're a couple weeks into this injury, week and a half or so. How would you put the recovery timeline on Rasmus Alm as far as what he's probably doing right now? What does that recovery look like? Because we don't often get an insight into the player until we actually see them return to the field.
Yeah, actually, this is great. So, Rasmus Alm's injury was on June 1st. That's when we played that game. So, we're 2.5 weeks out from that point. I suspect that Rasmus Alm is able to put full weight on his leg. There may still be some soreness or pain when he does that, but he's able to stand on the leg. It can tolerate weight bearing. He's probably getting a lot of physio, a lot of therapy. That's going to involve things that are focused on both generating or promoting healing in the MCL itself, but also trying to maintain as much of his function as you can, so that you're not losing strength, or at least you're going to lose some, but you're going to try to lose as little as possible. So he's probably doing some gentle range of motion exercises with a little bit of resistance to keep the quadriceps and the hamstring muscles strong around that knee. He's probably riding the bicycle quite a bit to prevent stiffness. He's going to get electrical stimulation to sort of keep the neural connection to the muscle and that response high. He's not out there doing running and cutting drills. He's not going to do a lot of jumping. Those things are going to put undue force on the ligament that could cause re-injury or re-aggravation of the injury, or just be so painful he can't tolerate them, even if it's not harming him.
I know oftentimes when we see players return to the practice field, one of the first things they do are those straight line drills. So you're saying that when we do see Rasmus Alm return, noticing the types of drills he's doing can help guide what his recovery timeline might be. Straight line would come first, and then side to side, those quick pivoting motions, and then any other straightforward movement would come later in the recovery, close to when he's near full recovery from the injury.
Yeah, I think that's a great way to think of it. Straight line running movements are going to put the least amount of stress on the ligaments. Stopping, cutting side to side is going to put a little bit more. Certainly anything that's rotational, quick movements, especially things like trying to trap the ball and spin quickly and change directions. So if we start to see him getting to those activities, even if he's working out on his own, we know he's pretty close to kind of going live or kind of having contact drills.
Perfect. What kind of history have you seen with these kinds of injuries, either that you've treated yourself or that you're familiar with? Because obviously you're not just a board certified orthopedic surgeon, but you've been published. You obviously read medical journals. What are you familiar with, either in the sports industry or recovery timelines in general, that may help us get a feel for Rasmus Alm, and when we start to see him again, when we might see him on the field?
Yeah, the good news is that while it's a significant injury, an MCL injury again has a very good rate, very high rate of healing well without any surgical intervention, and return to play is actually quite excellent. So I was able to find a study. It was a 2021 on players from the European top five European leagues,
Hmm.
and found that greater than 70% of patients and players were able to return to play at the same competitive level that they were playing before. Less than 15% of them required surgery. So that would just be the tiny sliver of players who would have had an associated injury, something else in the knee, in addition to their MCL, or a complete rupture of the MCL. For the players who did return to sport, we found that their actual performance, their ability to get out there, to make their cuts, to put in the minutes, their work rate, the assists and goals, and all those sort of things were at least equal, if not slightly better. Interestingly enough, I think the average assists per 90 were slightly increased. Not exactly sure why that is, but maybe it's because they were younger players still developing. But that was the authors of that article looked at that over a 4-year period after those players returned to play. So it wasn't like they just got a snapshot. They actually did quite well.
So you mentioned the age may be a factor, whether it's implied or otherwise. Does Rasmus Alm being 28 years old change anything as far as your familiarity with recovery or timelines go?
No, I don't think that they dialed it down that well. I mean, they didn't have the data to say that 22-year-olds did better, 28-year-olds did not do as well. But they did show that if a player did play for another 4 years, they did quite well. So Rasmus Holm's 28. He
Hmm.
certainly could play till he's 32. Hard to speculate about that. And I don't think that this injury should be a contributing factor to his ability to play for many years and hopefully wear city red till the end of his career. But I think the best thing that I found in the research that I did actually is that the average return to play was only about 33 days. So it's not a long recovery, but it's significant. And, to miss a player for 4 games or 5 games is a big deal, but at least they can come back in season.
Yeah, and I know personally, I feel a little better hearing you describe this injury recovery, return to play timeline, knowing that we have the League's Cup break coming up in about a month's time. And so that allows Rasmus on probably a little bit to get himself right and to continue his recovery into the back half of the season. Dr. Nelson, thank you so much for joining us. Would you mind pivoting to, I think, the news that is fresh on everybody's mind, and probably the one that we have the most amount of information on, and the one that also kind of hurts the most, Salio Pompeo?
Yeah. Absolutely. Man, I just got to say, I watched this game. I saw this video live. I saw this injury happen live, and I knew exactly what Salio was dealing with. And I've seen on the socials, I've talked to other fans, like just the heartbeat of this town is stopped for that moment when Salio went down. If you all haven't seen the information that's been released by the club, Salio suffered an ankle fracture dislocation. He had surgery fairly immediately, whether it was Saturday night or Sunday morning. Not totally clear, but fortunately, the reports are that he's come out of that doing well. And so, happy to speak about that injury today, and hopefully alleviate some of the fear, the anxiety, the worries that all the fans are having about this.
I'm sure everybody has read the press release, but like you said, an ankle dislocation, fibula fracture. They've already said Salio's out for the entire season. A recovery timeline the club put at was not at least a 9-month rehab before returning to competition. Talk us through the injury itself. So the ankle dislocation, the fibula fracture. Let's go even as basic right now as, what does an ankle dislocation mean and what is a fibula?
Yeah, sure. So the ankle joint is made up of three bones: the tibia or the shin bone. There's a smaller accessory bone called the fibula, which is sort of the outer bony prominence of the ankle. And then inside that space is going to be a third bone called the talus. That's basically the foot bone. And so the foot sits in this kind of dome that the shin bone and the fibula make. And so the foot's in here, and that's going to be your ankle joint. So when you have a fibula fracture, that is the smaller bone is injured, that can introduce instability. There's an opportunity for the fractured part of that bone or the broken part of that bone to shift, and then the square bone of the foot, the talus, can also shift in and out of the ankle joint. And so unfortunately, that's what we saw happen with Salio. The ankle joint stability is going to come from a combination of those bones and their positions, but also ligaments that connect those bones. And so an ankle fracture dislocation always involves a broken bone with torn ligaments. And frankly, a dislocation of any sort is basically like a bomb goes off inside the body. All the ligaments are torn. And that's why, you end up with these of a leg out of position, and why it can be so disconcerting for fans or spectators when they see this, because this isn't what we're used to. And it really just got me said, like, that's not right. That's not supposed to happen.
I think the severity of the injury was immediately known based on the replay that we saw and the way that the leg was crushed and moved so unnaturally. But does this also explain why there was an immediate, let's say, brace or kind of compress put on Salio's ankle right in the moment because they knew the severity and they needed to stabilize that ankle because of the movement that you just described?
Yeah, exactly. So apart from just being painful for the player, the soft tissue injury that can come associated with these can be even more devastating than the bone injury. Bone heals fairly well, and certainly in a young athletic person like Salio, he's going to have a great prognosis for bone healing. But skin injury from the stretch of the limb being deformed could actually be more devastating for any person who would suffer this kind of injury. So the first thing that I thought about is, oh no, is this an open injury? Might this be an injury where the skin is torn and the bone comes out? I'll be honest, I did go back and scrutinize the video to look for any evidence of that. He's wearing white socks, so if there was blood on the sock, that might be a clue. Just because I know that I've treated many patients with these injuries, and a skin injury can be the biggest problem for them. Fortunately, I didn't see that, and I'm certainly hopeful that Salio doesn't have to deal with that in addition to other things he's got facing him.
Because we do have examples of worst case scenarios with these types of injuries, right? Alex Smith comes to mind. I think when we were talking this weekend, he was one that you pointed to as an absolute worst case scenario in comparison to this, right?
Yeah, Alex Smith's injury was a little bit different. If you guys remember, Alex Smith played quarterback for a number of teams, Kansas City Chiefs, as well as for the San Francisco 49ers. He suffered an injury in play that was actually a tibial shaft, so higher up in the leg, but it was an open injury, meaning that the skin tore, and he ended up developing an infection in the process of his treatment. And the soft tissue piece of that injury became sort of the overriding narrative for him. Took him many, many months, and I would say miraculously, but like certainly with a lot of fortitude and great care, he was able to come back. Fortunately, that's a little bit different from Salio's injury, and the outcomes of ankle fracture dislocations are actually pretty good considering how bad the injury are, assuming that the skin is fine. And so he got immediate care for that, and hopefully we'll see similar things with Salio.
So looking at what's ahead for Salio Pompeo, the club has obviously said 9 months for his recovery. He's 24 years old. So can you talk us through a little bit about what is ahead for Salio Pompeo? We're not going to see much as fans. There's no doubt that everything's going to occur behind the scenes in his recovery, but we care about this player so absolutely much. Talk us through a little
Oh,
bit about
absolutely.
what's ahead for Salio.
Yeah, just briefly, for the fans who are probably wondering, I mean, Salio did have surgery. We know that he likely received a metal plate with screws on the fibula, the smaller bone in the ankle, to stabilize that bone. That helps to push the foot back inside the ankle joint. He, I suspect, also received some sort of treatment to address a ligament injury at the same time. Again, we don't know that. I'm not treating Salio. I don't have inside knowledge to divulge his medical information, but that would be typical for this kind of injury. As far as what his future looks like, generally an ankle injury like this is going to be immobilized for a couple of weeks while the skin incisions are healing to get swelling out of the limb. Then, depending on the nature of the injury and specific details about that injury, he may begin coming out of immobilization, working the ankle right away. I like to have patients at around 2 weeks start to do ankle therapy. That may not be, that wouldn't involve putting weight on the leg necessarily, but it would involve range of motion, stretching, things that can improve their joint sense, which is called proprioception. That helps with balance and helps prevent injury later. So at 2 weeks, hopefully he's able to start doing those things. Depending again on the extent of the bone injury, he might actually be able to start putting some weight on the leg while in a brace. Full weight bearing generally will start after 6 or 8 weeks of treatment so that the bone has had a chance to heal. And at that point, we would start to expect him to be riding the bicycle, working on some fitness and muscle types of activities. Full activity without bracing, closer to 3 months, which is why these injuries can take so long. But I'll give the caveat. Some people may remember Andre Gomez. He was played for Everton. He suffered an ankle fracture dislocation during play back in 2019. He had a really fantastic recovery. Surprised and impressed at how quickly he was able to get back. I think he was back to play in February of 2020. So it was something like 112 days. That would be incredibly fast. But there is that hope that Salio can have a similar type of recovery. On average, however, patients and players who suffer this kind of injury have a recovery that's closer to 9 months. So I looked at another research study that showed players in top five leagues in Europe had a return to play 35 weeks. So that's just around 9 months. And so it all depends on the specific details of the injury and how well players progress through their physical therapy.
And is there any data that we have to set expectations on what Salo Pompeo might look like in the future, whether it's a player of his age, a player of his position, or you mentioned Rasmus earlier? Is there any indication as to what the effects of this injury are long term?
Sure. So, from a performance standpoint, the data is actually pretty good. 80% of players were able to return to same level of competition with about 1 year later. So obviously this season is out, but we're looking for and hoping for Salio to see him with his smiles and his energy back on the field next season. Attackers actually did slightly better than defenders, so maybe that works in Salio's favor as well. And they had slightly improved output. Again, maybe it's because they worked so hard and they knew what they put into it with that determination to come back and show what they could do. But they did not see any significant drop off in assists, minutes per game, or goals scored in attacking players. So I'm very hopeful for Salio. I know he's got support certainly from the fans. I hope that he can lean on the people who are close to him and really fight through, because the recovery can be fairly grueling.
Dr. Craig Nelson, board certified orthopedic surgeon from SSM. Thank you so much for joining me on Flyover Footy. It's been an honor and a pleasure to have you on. We hope to have you on whenever we need to, I would say. Although, given the nature of your profession and what it means for our players, it probably wouldn't bother anyone to not hear from you for a bit. But we so value your time, and thank you for providing this insight into us here on Flyover Footy.
Hey, Matt, look, the pleasure is all mine. I'm a fan just like anyone else, and we love all the time and effort and passion that you guys put into this to foster our community. And so thank you to you. And certainly, I know I don't take it personally. I'm the guy that people are glad is around but don't want to see. So if you don't have to hear from me because we don't have any more major injuries, that would be fine too. Thanks so much for having me.
Yeah, you can bet that we will invite you on whenever we need you to, though, because this has been such a fascinating conversation. We hope you like it, listening to it, watching it on YouTube if you're able to. I'm Matt Baker. Thank you so much for joining us on Flyover Footy for this special medical minute on our podcast. Talk to you later.
Yeah. Have a great day, everyone.